Making decisions on behalf of loved ones who are dying can be a difficult and very emotional process. Jill Brooks has chronic obstructive pulmonary disease, and sadly, she will die soon. But when that time is near, she doesn't want doctors to intervene by trying to resuscitate her, but she must make her requirements known now. Recently, Jill and her husband Phil faced the reality of her situation.
When I was asked in hospital by the doctor about a ventilator for Jill, I told him that she wouldn't want a ventilator if she doesn't improve her life. And he said, well, she probably wouldn't come off it anyway. So I said, no, she won't have it. Now, I felt at the time that I could have been betraying her then. And it wasn't until they brought her around that they asked her themselves. And she said what I said, that she wouldn't want it.
Phil was quite right to say that I wouldn't want to have lived. It sounds terrible. I couldn't live like Christopher Reeve lived, if you like. You know, cabbage is an awful word, but no life. I've always been an extrovert and lively person.
How are you?
Jill and Phil are being supported by Healthcare at Home, a private company which has been commissioned by Birmingham East and North Primary Care Trust. This pilot project provides a family liaison coordinator to help decide what's best for Jill as she nears the end of her life.
When we mentioned it to Karen, she said that they have this choices system where Jill could write it down what she wanted to happen to her in the event that she wasn't able to speak. And as long as it got past the GP and he signed it, it takes the pressure off me then.
Choices are the most important thing that we can give to patients who are living with a life-limiting condition. And I see the family liaison service role very much about going and discussing what is happening to you, what do you know is happening as far as treatment goes, how do you feel about that, what choices do you want to make around further treatment, further care, and actually where would you want to die? And I think that most people have an idea of where they want to die, but how often are they asked the question? And if we don't ask that question, I feel that we're letting them down.
To be able to make my own choices and have somebody listen and be honest with me, and me being able to be honest with them, has made one hell of a difference to me.
With the help and support of Karen, they've completed a Do Not Resuscitate document, which clearly states Jill's wishes to all medical professionals involved in her treatment.
This is a document showing Jill's advance wishes, where she refuses treatment. Specifically, Jill's wrote here, her wishes are, I do not wish to be ventilated in these circumstances, even if my life is at risk. This has been passed to Jill's two sons, so they know. That's it. Every time she goes to hospital now or sees the ambulance, and I give them that, and it's there in black and white. At first, it was very upsetting to talk about it. But it's necessary. It's necessary. Because if for instance, the worst happened and Jill was on a ventilator machine and couldn't come off it, she would never come home again. Or she'd have a machine at home and she wouldn't be able to do anything. There's no quality of life. Although the last thing I want to do is lose her. I have to agree with this. This has got to be the best way. Eventually, this disease is going to kill her. But it's better for her and me to go into a sleep sort of thing, rather than try all sorts of machines to keep her going, when that's not what she wants.
I know I'm worse than what I was. But no, I feel a lot better knowing that what my wish is being granted.